All right, guys, I am back. I got cut off, but I'm back. So let me get started. Oh, let me just remind you guys, I do not have or own any rights to any of this information that I am sharing. I am strictly taking it from a Quizlet platform that has already been created. I am using it for my personal reasons so that I will be able to have a better study tools for me to be able to learn and memorize this information better. And in return, I am allowing others to reap the benefits of my studying material. All right, got it. So let's get to it. Next word that we left off on is social interest. The attitude of a client the attitude that a client has regarding their society, a sense of empathy and identification with larger communities. Splitting the client soup, never heard of that before, but okay. A technique that reduces the usefulness and of a client manipulative behavior by pointing out the manipulations. The therapist effectively defeats the client's anticipated results of manipulation. Striving for superiority, the desire to become competent and perfect, also known as growth force. Task setting and commitment, the technique taught to the clients to formulate realistic, attainable goals that can be revised if necessary. Let's let her tell us this.
Arnold Lazarus, Albert Bandura, Joseph Wolpe, and Alan Kasten. The behavioral theories of psychological development and therapy that developed in the 1950s and 1960s were a radical protest to the psychoanalytic theories that had held sway for many years. The key figures in behaviorism were.
So, the key figures in behavioral analysis were behavioral therapy, and the main goal of behavior therapy is to eliminate negative learned behaviors or self-defeating behaviors by having the client learn new, more effective, and positive ways of dealing with situations that create behavior problems. Assertive training, teaching skills and techniques for dealing with difficult situations in ways that are direct, firm, and clear. Basic ID, an acronym for the 7 major areas of personality functioning: behavior, affect, sensation, imagery, cognition, interpersonal, drug, and biology. That was Lazarus, 1981. Behavioral rehearsal is a technique of trying out new behavioral approaches that can be used in real life situations. Coaching, providing clients with general principles of how to make effective behavioral changes. Cognitive restructuring, the process of identifying and understanding the impact of negative behaviors and thoughts, as well as learning to replace them with more realistic and appropriate actions and beliefs. Contingency, contracting, the specific delineation of behavior to be performed, changed, or discontinued, along with the rewards for the performance of these contractual items. The conditions under which these rewards are to be received, and then the time that is limited. Counter conditioning, the process of restraining problem behaviors and introducing new behaviors. Feedback, the process of providing the client with verbal responses to behavior changes. The 2 parts of feedback are encouragement and praise. For attempting the behavior change and specific suggestions for making behavioral change work better. Modeling, the process of showing new ways to do something. The therapist can help the client to do this by role-playing the type of behavioral that is desired. Albert Bermuda has done much of his work this way. Multimodal therapy. Let's just see what it says.
Multimodal therapy.
Multimodal therapy. The process therapist invokes in making an evaluation of the client's level of functioning at the beginning of the therapy and subsequently adjusting procedures and techniques to the goal of the client. The behavioral change is a function of techniques, strategies, and modeling. Arnold Lazarus developed this type of therapy. Negative reinforcements. When the removal of an adverse stimulus is likely to increase a problem behavior. Operant conditioning, a concept from B.F. Skinner, a learning therapist, that says behaviors of an active organism are controlled and controllable, even without actual consequences each time. Positive reinforcement, a conditioning technique where an individual receives a desirable result for a positive behavior that subsequently increases the probability of that behavior occurring. Progressive relaxation, a technique employed to increase the ability of the client to control his or her stress level by gradually having the client relax. Reinforcement, a specific response to a behavior that increases the probability of that behavior being repeated. Self-instructional training / management, strategies used to teach coping skills in problem situations such as anxiety, depression, and pain. Realistic goals are set and constantly evaluated. The consistent use of a particular strategy is essential, and support systems are important, as are they use the self-reinforcement in order to achieve success. Self-monitoring, the process of observing one's behavior, patterns, and interactions in social situations. Social learning therapy, a therapy originated by Alfred Bermuda. The therapy holds that behavior is understood by taking into consideration the social conditions under which learning occurs, as well as individual psychological factors. Systematic desensitization, the process of teaching a client to become less sensitized to a particular stimulus, thereby reducing anxiety. The techniques consist of relaxation exercises combined with an imagined series of progressively more anxiety producing situations. It was developed by Joseph Woolop and is based upon the principles of classical conditioning. Technical electricism is the process of using different techniques from different therapies to achieve behavior changes. The result is flexibility in the therapeutic process. Cognitive behavior. In cognitive behavior therapy, clients explore reasons for their behavior by understanding their thoughts. They are also encouraged to look at the ramifications of their behavior on themselves, others, and the environment in which they live and function. Albert Ellis, he's founded the rational emotive therapy. Robert Ellis, he believed that the concepts of insight and awareness into the childhood events do not result in resolutions of present emotions, dysfunctions. He also theorized that the connection between the past and the present was not explored fully in psychoanalytic theories. Rational emotive behavior therapy, also known as REBT. The key concept in rational emotive behavior therapy holds that even though emotional malfunctions is rooted in a childhood's disturbances, individuals continue to reinforce their irrational and logical thinking. Emotional problems are the results of irrational beliefs.